Option 2, also known as Levonorgestrel, is a medication used by women to prevent pregnancy after birth control failure or unprotected sex. It is an emergency contraceptive and should not be used as a regular form of birth control. It will not stop an existing pregnancy or protect against sexually transmitted diseases. It may not work well in women over a certain weight or if certain other medications have been used within the past month, which can result in pregnancy. It is important to talk to your doctor to see if this medication is right for you. Be sure to check the ingredients on the label, as the manufacturer may have changed them, and products with similar names may contain different ingredients meant for different purposes. Taking the wrong product could harm you. When taking option 2, if you are using the over-the-counter product, make sure to read all the directions on the product package before taking it. If you have any questions, talk to your pharmacist. If your doctor has prescribed this medication, take it as directed. Take 1 tablet by mouth with or without food as soon as possible after unprotected sex. This medication works best when it is taken within 72 hours, 3 days, after unprotected sex. If you vomit within 2 hours of taking this medication, contact your doctor to ask if you need to repeat the dose. After taking option 2, the time when your period comes and how much you bleed may change. Tell your doctor right away if your period is more than 7 days late. You may need to take a pregnancy test. If you think you may have a serious medical problem, get medical help right away. Some common side effects of option May 2 include nausea/vomiting, abdominal pain, tiredness, dizziness, changes in vaginal bleeding, breast tenderness, or headache. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects, such as severe lower stomach pain, especially 3 to 5 weeks after taking Levonorgestrel. While a serious allergic reaction to this drug is rare, seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's essential to note that this is not an exhaustive list of possible side effects, and if you notice any other effects not listed, it's important to contact your doctor or pharmacist for further guidance. If you reside in the U.S., you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking option 2, make sure to tell your doctor or pharmacist if you are allergic to it or other progestins. This medication may contain inactive ingredients that can cause allergic reactions. It's important to talk to your pharmacist for more details. Before using this medication, inform your doctor or pharmacist about your medical history, especially if you have unexplained vaginal bleeding. Option May 2 cause dizziness. Avoid consuming alcohol or marijuana as they can make you more dizzy. It's important not to drive, operate machinery, or do anything that requires alertness until you can do it safely. Limit alcoholic beverages and consult your doctor if you are using marijuana, cannabis. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's crucial to note that this medication must not be used during pregnancy. If you become pregnant or suspect that you may be pregnant, inform your doctor immediately. Option 2 passes into breast milk but is unlikely to harm a nursing infant. However, it's important to consult your doctor before breastfeeding. When taking option 2, it's important to be aware of potential interactions with other medications. Some drugs may decrease the effectiveness of emergency birth control, leading to a higher risk of pregnancy. These include griseofulvin, modafinil, rifamycins, such as rifampin, rifabutin, St. John's wort, drugs used to treat seizures, such as barbiturates, carbamazepine, felbamate, phenytoin, primidone, topiramate, HIV drugs, such as nalfinavir, nevirapine, among others. It's crucial to keep a list of all the medications you use and share it with your doctor and pharmacist to avoid any potential risks. Be sure to consult with your healthcare provider for more details, including the optimal timing and daily dosage for option 2. It's very unlikely to overdose on option 2. However, if someone does overdose and experiences serious symptoms like passing out or difficulty breathing, it's important to call 911 or a poison control center right away. In the US, you can call your local poison control center at 1-800-222-1222. For Canadian residents, you can call a provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting. Remember, always take medications as directed and never exceed the recommended dosage. Make sure to schedule and attend all your medical and laboratory appointments as directed by your healthcare provider. This is important for monitoring your progress and ensuring the effectiveness of option 2 in treating your condition. Your healthcare provider may need to conduct regular checkups and tests to adjust your dosage or treatment plan as needed. Follow their instructions carefully to get the most benefit from option 2. Option 2 is a medication used to relieve symptoms of indigestion, heartburn, and upset stomach. It works by neutralizing stomach acid and providing relief from discomfort. The usual dosage for adults is 2 to 4 tablets taken as needed, but not exceeding 16 tablets in 24 hours. It is best to take option 2 after meals and at bedtime for best results. When storing option 2, remember to keep it at room temperature and away from light and moisture. It's important to store it in a place that is out of reach of children and pets. When it comes to disposing of option 2, it's important to not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. If you're unsure of the best way to dispose of option 2, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.